This is 7 National News, and in our top story, the Abu Dhabi Crown Prince welcomed the Belarusian President and his accompanying delegation on Tuesday. His Highness General Sheikh Mohammed bin Zayed Al Nahyan, Crown Prince of Abu Dhabi and Deputy Supreme Commander of the UAE Armed Forces, received the visiting President of the Republic of Belarus, Alexander Lukashenko. Also in the meeting were members of the visiting delegation, senior officials and dignitaries from the UAE, led by His Highness Sheikh Tanoon bin Zayed Al Nahyan, Deputy National Security Advisor. Among the topics discussed included the state of friendship and cooperation ties between the UAE and Belarus, with a focus on ways to enhance them, issues of bilateral relations between the two sides, and other issues of mutual interest. They also exchanged views on the level of existing relations and ways to encourage partnerships among various sectors in the UAE and Belarus, particularly the development of economic and investment ties to serve the two countries in the best way possible. Sheikh Mohammed said that the UAE, led by President His Highness Sheikh Khalifa bin Zayed Al Nahyan, is keen on building constructive relations with all countries across the world in cultural, educational, economic, trade and other fields. In turn, Lukashenko expressed his happiness at visiting the UAE and familiarizing with its urban and developmental experiences. They also exchanged views on a number of international and regional developments. The UAE has called for strengthening the role of women in achieving international peace and security. Speaking at the open debate on women, peace and security, Ambassador Lana Zaki Nuseibeh, the UAE permanent representative to UN, delivered a statement to the Security Council on Tuesday in New York. The debate focused on the effects of forced displacement on women refugees and internally displaced persons. Ambassador Nuseibeh highlighted the urgent issue of displaced women and girls as new crises and outbreaks of violence increase the levels of forced displacement to its highest level since World War II. She placed this discussion in the context of UN Security Council Resolution No. 1325, adopted in the year 2000. The resolution recognized the importance of women in the prevention, mitigation and resolution of conflict, as well as the differential and unique burden that women and girls bear during conflict. She also underlined measures that the UAE has taken to prevent and protect women from violence at the international level and reaffirmed the UAE's commitment to advocacy at the UN level. Ambassador Nuseibeh reiterated that we must recognize women as the agents of change that they are and not solely as the victims. The Roads and Transport Authority has announced that tomorrow it will open the main traffic diversion on Wasl Road near Safa Park, stretching about half a kilometre. The traffic diversion will maintain the same number of lanes to avoid disruption of traffic flow and will set the ground for commencement of construction works on Phase 2 of the Dubai Water Canal. The planned traffic diversion on Al Wasl Road includes the traffic flow coming from Jumeirah 3 and Al Safa 1 to Jumeirah 2 and Al Wasl. The Water Canal project is divided into 3 phases, with the first phase including the construction of bridges across the planned water canal on the Sheikh Zayed Road, comprising 8 lanes in each direction. Phase 2 includes the construction of bridges on the Jumeirah Road and Al Wasl Road, comprising 3 lanes in each direction of the Jumeirah Road and 2 lanes in each direction of Al Wasl Road, in addition to a ramp from Al Wasl Road to Hadika Road in the direction of the Sheikh Zayed Road. The Dubai Health Authority is reminding companies that the first phase of compulsory health insurance cover for employees in Dubai becomes effective on October 31 and is estimated to involve approximately 300 companies who employ 1,000 or more employees. According to authorities, the first of 4 phases is expected to cover up to 700,000 employees. Non-compliance with the law will result in fines and penalties that will be levied on the companies who fail to pay the full cost of basic health insurance for each employee. DHA Director General Isa Al-Maidour was quoted as saying that so far, the authorities are pleased with the results of the rollout and are thankful to all those employers who have supported the scheme by adhering to the deadline. However, Al-Maidour added that there are still some employers who have not yet made the deadline and the DHA is urging them to act promptly. The legal requirement is for providing the basic insurance package that falls between 600 to 700 dirhams annually. However, there are companies that are providing more than the basic package and also providing insurance cover for dependents, although having insurance cover for the dependents will be covered in Phase 3 of the implementation, which falls in 2016. Providing information on how the law would be implemented, Al-Maidoor said that soon the DHA will use direct electronic links with relevant government stakeholders to enforce the law, and that health insurance will be linked to the residency visa in collaboration with the relevant authorities, including free zones. And Dubai Healthcare City has announced online examinations for physicians and dentists from more than 30 countries representing Eastern Europe, Southeast Asia, the MENA region and the Indian subcontinent. The introduction of online licensing exams are part of a phased plan to strengthen the Healthcare City regulatory standards in line with the agreement signed by UAE health authorities for the unification of medical licensing and in line with the Dubai Smart Government Initiative. The online exam will help increase the pool of healthcare professionals and operators, boosting the Emirates economy and promoting specialization, according to a report released by Emirates news agency WAM. Dubai Healthcare City has partnered with renowned testing provider Prometric to ensure that the online licensing exam follows stringent check-in procedures that require biometric capture of fingerprints to eliminate any fraudulent activity. Once a candidate passes the online exam, they can then apply for a license, provided all other eligibility requirements are met for the specific professional category. These eligibility requirements include education, training, licensing and work experience. There are currently 11 exams available across a number of healthcare disciplines, with additional licensing exams to be introduced in phases over the next year. The Customs Department of Ras Al Khaimah has signed an agreement with Emirates Post Group to manage the domestic and international courier requirements of rank customs for individuals and organizations. Under the agreement, Emirates Post Group will provide courier services for the shipment of documents of individuals and organizations from Ras Al Khaimah Customs headquarters to addressees within and outside the UAE. Officials stated that local delivery would be within 2 working days, depending on the location and the emirate, while international delivery will be as per higher global standards. In addition to signing the agreement, the two sides have undertaken to look at ways to promote further collaboration to improve customer service, with arrangements in place for follow-up meetings to review the partnership and raise standards further. And finally, in the bulletin, one of NBA's all-time greatest players was in Al Ain today in support of the UAE's continued efforts to raise awareness about diabetes and the importance of healthy living. Across the globe, type 2 diabetes is on the rise across all age groups. The UAE is currently ranked 15th worldwide, with 18.98% of its population living with diabetes, according to the International Diabetes Federation. American basketball legend and goodwill ambassador Kareem Abdul Jabbar led the walk around Al Ain municipality grounds to raise awareness and educate the community on the benefits of walking. In a lead-up to Walk 2014, Take a Step for Diabetes, over 400 school children from Brighton College Al Ain and Indian High School Al Ain joined the 7 feet and 2-inch Hall of Fame Centre and global icon. Students and civic body officials present at the event engaged in a discussion with the NBA's all-time leading scorer about how to eat healthy, types of exercise and many more. Taking from his own personal life and lessons learned, Kareem says it is important to reach out to as many people as possible and educate them about eating healthy and adopting an active lifestyle to save lives.
Eating a balanced meal like this. I've contracted cancer, I have leukemia, I had prostate cancer, and I'm surviving those. So I understand how health issues can be a big thing in someone's life. In my own life, my mother had old age onset of diabetes, and it really influenced her death. So, knowing that people are going through this unnecessarily, it's time that people do something about it. And so the message that the government here is trying to get across to the population about taking care of themselves, diet and exercise will definitely add to their lives and enable them to do the things that they want to do. Good diet and an exercise routine is something that helps you throughout your life. If you can get that message across early enough, it holds, and you won't have the problem of people forgetting that they need to do certain things with regard to their health.
This is in a lead-up to the Imperial College London Diabetes Centre's annual walkathon. Walk 2014 will take place around the Formula One Grand Prix track at the Yas Marina Circuit on the 7th of November. According to ICLDC CEO Bashar Al-Ramahi, a daily 30-minute brisk walk can save lives. Following the event's success last year that saw the participation of nearly 22,000 people, this year they will also run a community health check on site.
The trend that we're seeing lately is that we have a lot of people who come to our center just for screening. They are aware that diabetes is a problem, that it does have high prevalence, but they come in and say, I don't know if I have diabetes, I need to get checked. And that trend is increasing, and we're very happy about that. While maybe 5 years ago, most of the patients who were coming in were confirmed diabetes cases seeking treatment. Now we see, especially in Al Ain, now we see more people coming for screening, and I'm extremely happy about that, because with diabetes, if it's caught early, we can treat it very effectively. It preserves all the other organs like the kidneys, the eyes, the heart. You don't have to have those complications.